Hi, everybody. Welcome back to Wellness Wednesday. Today, we're joined by a panel of experts, and I just wanted to introduce our new patient education manager, Mike, and he will be taking over the host of Wellness Wednesday. So pass it over to Mike.
Hello, everyone out there in Fight Colorectal Cancer Nation. I am Mike Morositz. I'm the new patient education manager, and I'm really happy to be here for you as a partner in Wellness Wednesday. So tonight, we're going to be talking about flu season because this is a big thing this year, especially with COVID-19 still going on, and we want to make sure you're able to make some health and safety and safe choices going into the season. So first, we want to introduce our panelists here who will be helping in this discussion. So first we'll start off with Anna. Can you please introduce yourself?
Of course, I know that my dogs are going to come in right now, so you guys may get to see my dogs. I'm Anna. I am a stage 3 rectal cancer survivor. Here come the puppies. And I am also a registered. I work in breast oncology at Stanford Healthcare, although I'm mostly a public health nurse and women's health nurse by background.
All right, thank you so much. And Dr. Lomax, will you please introduce yourself?
Hi, yes, I'm Jana Baldwin-Lomax, and I'm a clinical health psychologist licensed in Colorado and have a long career of working in cancer centers around the Denver metro area and have a private group psychology practice with other health psychologists in Denver, but it's also all over the state and some other states due to telehealth options. So I specialize in helping people who are coping with cancer, post-cancer, their family members and caregivers, as well as anyone who's dealing with other chronic medical conditions.
Fantastic, welcome. And Anne.
Hi, I'm Anne Ogden-Gaffney. I'm the founder of Cook for Your Life, which is an organization which teaches healthy cooking to people touched by cancer and is now part of the Fred Hutch Cancer Research Center in Seattle. And I've been teaching cancer patients about how to put nutrition advice into practice for, well, seems the last 12 years or so, I guess, at this point. So it's a great pleasure to be here and address something else, flu. So thanks for having me.
Absolutely. Well, it's our great pleasure to have you. So now we're going to go through a few questions just based on all of your specialties here to help give our listeners some great tips this season. Okay, so starting with Anna, why is it important for cancer caregivers to receive the flu vaccine every flu season, but specifically and especially this flu season?
Yeah, so it's important to get the flu vaccine because it's actually that anybody who is over the age of 6 months is considered at high risk. So every year we have patients dying of the flu. I think that this is a lot more discussed in the news than it previously was, I think, with COVID and all the comparisons that have been made with the flu, but the flu still does kill more people every year. And actually last year, the 2019 to 2020 year that just ended, so in our spring, that typically is when the flu season ends, had the highest pediatric, so children death ever in history of flu. So it's particularly important to protect our children and protect anyone who is at high risk. And with COVID, basically the reason it's most important right now is because if you have the flu and then you also pick up COVID infection, you're at higher risk of dying of COVID and also vice versa, because anything that kind of assaults your system is going to put you at higher risk to get sick.
Wow, so you can simultaneously get COVID and flu.
Yeah, I mean,
at the same
to my
time?
knowledge, I don't think they've had cases of that yet, but I did not look. I think we're not really in flu season yet. We're kind of more in the flu vaccine season. That's why they tell you to typically get it by the end of October. But it certainly is possible. And what's difficult is that it has similar symptoms. So we're never really going to know and whether or not what you really have. You can also have a cold. So I think one of the tricky parts, especially when I hear patients or anybody being like, well, I still got the flu, even though I got the flu shot, it's possible you had a cold. It's possible you had a virus. There's a lot of things that have similar symptoms. So it's kind of hard to differentiate whether or not you have a cold, whether you have the flu, whether you have allergies. I know for myself, and I'm sure a lot of people out there, every time they cough or sneeze, they're like, oh my gosh, I have COVID. And it's probably because we're having bad air here in California, not because I have COVID. But it certainly is possible, especially with the more cases we're seeing of people who are asymptomatic or having really mild symptoms, that they might have both at the same time.
Yeah, so ultimately, definitely not overcomplicating things by
No.
increasing your risk. You want to make sure you're keeping yourself protected this season with a flu shot. Thank you so
Right.
much.
Yeah.
Right. Next question is for Dr. Lomax. Many cancer survivors and caregivers will be isolated to their homes this flu season to avoid sickness, both COVID-19 and flu. What are some strategies to stay connected without feeling isolated?
Man, I hope that many of us are getting better at trying to figure out how to stay connected. And you're hearing a dog in my background too. um, Figuring out how to stay connected during this physically distanced life that we're living in. But I think one of the things that is important for us to continue to do is to celebrate regularly, make plans with one another. Because I know many of my patients and people in my personal life are really feeling that loss of things to look forward to. And so that I think that would be an important part, especially as we're coming upon the holidays that are going to look quite different than what we're used to, is to plan to share meals, even virtually, with people that we love or people that we want to get together with. I think book clubs or other ways of regularly getting together or having something to anticipate talking about could also be a really nice way of maintaining connection. But I think one, really important thing is celebrating little things, getting together and sharing with people around, what's happening for you, what are the little wins, because it feels like we've lost so much of the things that we are used to doing and used to expecting happening around these times. We're just, so familiar with our lives being punctuated by certain events and certain things that aren't happening now. So it feels very discombobulating. So I would suggest, really trying to make plans and trying to stick with those even virtually. I know some people feel a lot of fatigue around looking at themselves in the screen and being on screens. So phone calls are also perfectly fine. The one thing I would just recommend being wary of is feeling connected via social media, because we actually know that more time spent on social media is a risk factor for increased feelings of isolation, depression, and anxiety. So I actually monitor this in all of my patients. How much time are they spending on social media? It's particularly anxiety provoking right now, given all that's going on in lots of different arenas. So when people say, well, I do a lot of texting and I'm reaching out to people via Facebook, I really suggest that they try to find other ways of connecting really in a personal way. And then, I don't know, wherever people are in the country, trying to find ways of physically distancing, but socially gathering. So getting together, in a park far away, but seeing one another and being able to engage has such a benefit. And I know a lot of people in Colorado are concerned about the weather changing, but I would just suggest, get on your layers and get outside for some fresh air, because that's going to be really key for your mental health and physical health as well.
Great. Yeah. For those out there that aren't as tech savvy, certainly, we need different ways to still stay connected. And especially as it gets colder, bundling up, putting on a scarf and getting out there could really make a huge difference to keeping that connection going. Also
Huge.
thinking about eating meals with family is making me hungry. So we have Anne as well who can help us. What are some foods that can help boost the immune system, but still be delicious?
Well, I mean, it's kind of coming back into an old chestnut of eat the rainbow. There's no one food that, or a pair of foods that are going to sort of make you boost your immune. But if you can get into the habit of eating, home cooked meals, which we're doing a lot of the moment, and in a way, that's for me, as a cooking advocate, that's a silver lining, if you like, of this COVID moment, is that people are having to cook more at home. But to cook get as many fresh fruits and vegetables into your diet as you can, because all the micronutrients in those, they're what is going to help your body, give your body strength to fight these things in a way that popping supplements just won't. So it's, this is what I kind of advocate all the time. And, me personally, I miss very much the cooking for people, having people over for for dinner. But we have been doing some actually Zoom dinner calls with people, which is quite fun actually. So you can still do it. But I think if you can just try and get a big variety of fresh fruits and vegetables into your diet, you're going to feel so much. You're going to be doing your body a favor at this time of year.
Great. So it's not necessarily about finding that one perfect recipe, but just getting the time in, getting the energy in to cook something great and finding that variety. That's
Yeah.
great. Is there any
Yeah.
one particular cold weather meal that you can get people's ideas started for as the weather gets colder?
Well, one of my favorite things to get, especially, I mean, I'm starting to do it now. There's a nip in the air here in New York City. So I'm sort of like into it. It's soup, of course, because I find that soup is one of the best ways to get in your 5 fruits and vegetables a day, if you like, and in such a really comforting kind of soothing way. So actually, just this weekend, I made a big pot of my grandma's minestrone. So that was was really kind of a great thing to do. And I think it's these kinds of things that they comfort and they nourish, and I think those are things to kind of aim for.
Absolutely. That sounds great. All right, Anna, getting a little bit more specific here, what are some precautions that cancer patients and caregivers for cancer patients can take to avoid getting sick this flu season?
Well, I
Well,
think.
of course,
Oh yes, go.
yeah, sorry.
Anna, I'm getting like, what?
Oh, I know, it's so confusing. Similar name. Of course, getting the flu shot is the number one. So, and I should have mentioned that when I was first talking about how it's so important to get a flu shot, is even if you yourself are doing well, you don't know about your neighbors, you don't know about family and friends. I know we're not interacting with people as much as we usually are, but for example, for us nurses in particular, it's a requirement of our job. And that's because we don't know what sort of patients that we're going to see or what sort of state that they're in. So that's why it's really important. And it's a pretty easy way to help protect yourself, as much as I hate shots. Okay, I'm a nurse. I give them all the time. I don't like them either. But it's pretty simple versus, it's versus having to do something like as great as it is to cook and I want to make a plug for exercise as well. That's another way that you can really help prevent the flu. I know all of these sound counterintuitive, especially with and Dr. Lomax said that as well, with getting outside, but actually there's a lot of evidence that healthy exercise activity, whether it's just walking around the block or parking a little bit farther away from your house and walking there, can really increase your immune system. So exercise and get a flu shot. Another thing is everything that we're getting told about COVID. So washing your hands. Do not count on other people washing their hands. I can't tell you how many people I see in hospitals not washing their hands correctly, especially for long enough. And I myself even have been guilty of doing this in the past. Don't tell my nursing supervisors. But, happy birthday is the most common one to sing. Yankee Doodle Dandy are another one. So sing that in your head to make sure that you're spending the entire time. I do happy birthday and try to look up a celebrity or something so that I have someone to sing it to. So to make sure that you're washing your hands the long enough. It doesn't matter how much you disinfect if you're not washing your hands. When you're using a mask, make sure that you know how to put it on and take it off. So remember that by far the most important part that you don't want to touch is the outside of the mask. So what I see people doing a lot is, and I know it's really hard to breathe with those things on when you're exercising, walk up a hill, you're pulling it down on your neck for when you don't see anyone around, and you pull that back up, all that outside bacteria is getting put right onto your mouth. So it's really about, I should have brought one, but, oh, I have one.
Emma, great.
Yeah, so this is a cute little cloth one, right? But it's really important that when you're taking it off, you're not doing the, or pulling it off from the front, but making use of the straps, right? So take it off so that it's nowhere near your face, because this is all of the risky part right here. If you have a paper mask, one little trick that we learned about, and this was, I believe, from the CDC, is if it's a paper mask like the one they give you in the hospital, you can actually rub it with a latex glove, and it actually causes a static charge and helps repel germs. I know that sounds fake, but it's actually been shown to be effective. It does not work with cloth masks. And also remember to wash these a lot. So don't just, like keep wearing them, as cute as they are. And also remember where you hang them, because, if I just like drop this, now I can't use it. So I dropped it on my table. Now it's contaminated, right? So, but I think those are, some things that we can do. And then I think probably one of the hardest things is that children, if you know you are at higher risk, this is probably not the time to see your grandkids, even if they have tested negative or, I know we're not really seeing grandchildren, but children, unfortunately, I mean, you can't expect a 4-year-old to know how to protect themselves. They can, we can teach them to wash our hands. If you're a parent, it's important to teach them. But I mean, I don't think I could have done that as a 5-year-old. So kind of be aware of who might be at greater risk. And I myself as a nurse, and probably teachers and others who, we're kind of in the thick of things right now, or, it's important for us to know that we should probably stay away from people that are going to be at higher risk if we can.
Excellent. Yeah, I think it's really a challenging time, where everyone's getting the fatigue of having been safe and being cautious, and, entering into this time where we have these regular activities that we're going into. What could you say as a message, perhaps of encouragement for those who are feeling a little bit of that fatigue and feeling not as likely to maybe put on the mask or do those things where we really need them to this season? What message of encouragement would you have for them?
I mean, I get it. So I'm I'm 100% extrovert. I'm not doing well working from home because I don't get that interaction. I'm grateful that my mom is here because of bad air quality, because it gives me interaction. But remember that if you want to be able to see your friends, if you want to be able to see your family again, we have to get out of this. So we have to protect ourselves now to be able to do everything we love again in the future. So it's a really tough sacrifice. It's a dark, dark time for everyone. And there's a lot of other things that are compounding it, whether it's political, whether it's fire season, we had an earthquake the other day. It was really small, but it's a really hard time to be alive, frankly. But if we think about it, the safer that we are now, hopefully the shorter amount of time that we'll have to be taking on these behaviors. So, and I personally find it helpful to get cute looking masks. I have another one that says vote on it that I plan on wearing through, I'm glad I don't have that one because I can't be political right now. But it's yes, the cloth masks aren't as effective as an N95, but it's something different, right? So at least you get to wear pineapples, or you get to, make it more fun. And everything that Dr. Lomax has talked about, where, finding joy in what you are able to do. I agree. I am the biggest, do the worst at completely ruining my day by looking at social media. So, any sort of restriction you can put on yourself with that, I'm the absolute worst. And then just, find the way to interact with people. And I also agree that with the screen fatigue, I've been surprised how wonderful it is to talk on the phone. And I think because we have gotten so used to this, it's almost like an old school way. I heard someone else also be a proponent of writing letters, which I thought was a really cute idea. So, I mean, we can support our mail service at the same time. So, think about like writing old school letters to friends and family. How fun is it to get a letter that's not junk mail? But I really, the important message is the better we do at this, the shorter amount of time that we'll have to do this. So it's really important. And I promise that I wear an N95 all day at work. It is not comfortable, but I've gotten used to it. So you will get better. So just stick with it and find small moments of joy that, can kind of boost your self-esteem and kind of boost with what's going on, give you a chance to smile, whatever that is.
Great. Thanks for sharing that supportive message. And now I feel like I need to go out and find a pen pal.
Yeah. You can write me. You can
Oh,
write
there we
me.
go. Excellent.
Yeah.
This is great.
Yeah.
Wellness Wednesday. Here we go.
Yeah.
All right. Well, jumping off of that, Dr. Lomax, with all of these things to think about, and especially with these, seemingly ominous, winter forecasts and everything, what can our people do to dial back some of these anxious thoughts? Do you have any strategies to share along those lines?
Yes, absolutely. I will just hop off your last comment about pen pal. Nursing facilities are very interested in people developing pen pal relationships at nursing homes, since they right now are restricted in visitors. So a number of my friends and I have found pen pals at nursing homes. So just a mention, if there's a nursing facility near you, I'm sure you could find someone to write to, or anyone could, just because visitation has been restricted. In terms of managing the anxiety around all of these unknowns, one, I've mentioned this, but I want to say more, is to monitor your consumption of both social media and the news. A lot of people wake up to pop-ups on their phone of news, and we can control for those things. We can shut off notifications. You can put your phone away from your bed. I think we've gotten so immune to the constant barrage of triggers that we don't recognize what it does for our bodies and our minds. It totally derails us from other things that we're interested in or focused on. So I would highly recommend that people look at, are they getting push notifications on phones or computers of news or emails? You can even shut off texts. I have, groups of friends that are texting about things going on in the world, and I've shut off the alerts just so that if I'm focused on something and being present in my day, it doesn't distract me. Because that's the thing I think that we, in order to develop resilience during this time, and that's been the main focus of my work with my patients, is recognizing that this is hard. It's really hard. And there's significant risk for anxiety and depression, just given all the losses, loss of control, loss of things we're used to, loss of jobs, loss of people we know. There's so much going on, and we need to acknowledge those feelings we're having and not dismiss them. So being, one of the tricks or tools I would recommend is sitting with uncomfortable emotions, letting our bodies, letting our minds and bodies know that emotions by nature are not good or bad. They are human responses to triggers. It's what we do with emotions that can be good or bad. If we numb them with substances, we're creating a bigger problem. But if we acknowledge, wow, turning on the news is really making my blood boil, maybe I need to think about doing something else. And so that's one of the tricks, is just sort of sitting with, having an experiment for a day and being mindful of your emotional reactions, whether it be to social media or to the news or to, people you work with. Maybe that's really triggering. So learning what your triggers are, and then having a sort of a toolkit or a, bucket full of things that fill your cup. And a lot of the things that we used to use that fill our cup aren't available to us right now. So it's really about getting creative. Maybe it's having puzzles, maybe it's coloring, maybe it's, doing some things that we have more control over, and trying, a new podcast or a new meditation. But I tell my patients, not one thing works for everyone. So I like to think of taking a month or even a week at this point in time. Time is feels weird right now. To experiment, to brainstorm what fills your cup these days. Maybe it's lighting a candle. I like to burn a stick of incense when I'm transitioning my day, because it really feels like okay, I'm working from home. When I burn that incense, it's like I'm off work. And so finding something that isn't a booze, a lot of people are doing that transition. I'm really worried about substance use right now for folks as they try to transition from this work from home to celebrating at home lifestyle. And then exercise is huge for managing anxiety and depression. I like to recommend people get up and move for 10 to 15 minutes first thing, before they have any sort of email, before they have any sort of, anything. Just get up and move, because you feel like I've done something for myself that I can control today. I can check that box that I feel like I did something and have some sense of control, because that's that no one, it's not a pathology to want to feel order, to want to feel like we have control of our schedules and our destinies. And we don't have that right now. And so to create that in our lives is really important for managing anxiety. And then having a level of acceptance around what we don't have control over, and being okay with having some difficult emotions around that. I stumbled upon a quote today that just happened to be timely, and I just wanted to read it. It says, "No amount of regret changes the past. No amount of anxiety changes the future. Any amount of gratitude changes the present." And I really feel like gratitude has gotten, popular, and some people think it's, too much of that. But I really think any amount of acknowledgement of the things that are working in our lives in the moment can be so changing for our mood and shift us out of one of those dark spaces.
Wow, very insightful. Yeah, it sounds to me like, we live in a time where being connected to media isn't synonymous with being informed and being in control. And hearing
My,
from you that we can, hope to find that within our more immediate surroundings instead of what tech we're connected to, I think it's really encouraging, because it's something that is just right around us at all times that we can start looking to and can start today, really. So thank you so much for sharing all of that.
Mhm.
And then, as we continue to talk about that, we're going to have to come back to food, and I'm going to need a little bit more than just that soup. And can you give me a couple more, perhaps, comfort foods to cook during these winter months that can help people get through the colder days?
Yeah, I think for me, again, I'm half Italian. That's half of my background, and so I'm always fond of pastas. But the pasta you can make them with tons of vegetables and things in them as well, so that you can get the nutrition benefit as well as like the feeling of comfort. But also, I think it's important, especially if you get a cold or something, is um, to have a lot of things that soothe. To have like a little armory of soothing drinks and teas and things. I'm English too, as you can hear, and I drink an awful lot of tea. But I think when you're feeling a little bit under the weather, to make something like just a drink of like hot lemon and honey, this kind of thing, which is it's kind of the simplest of things, but it's the most soothing and the best. It's these kinds of little things that can kind of make you feel really good. And the other thing is too, and it's interesting, listening to the conversation about control, because cooking does give you a certain amount of control. I mean, this is what I found when I was going through my own cancer treatment, that it was one of the things I could control. And since COVID, I've found that I've had a lot more time to do things. And I think that this is, I mean, it's not an oxymoron in terms of our conversation. It's just that I used to go to work, run home, make dinner as quick as I could. And everything was kind of like condensed into getting it on the table. Now I can get up, I can do something at breakfast. When I'm making breakfast, I can put something on. And I could, so I can put, on the slow cooker, or, what have you, or or when I'm making dinner, I can prepare a soup at the same time for the next day. So that everything all of a sudden is getting sort of stretched out, and it's things that I would never do, because they would be a hassle to do if I was trying to get it all in like, 30 minutes when I got home. Now I can do those things. And I think, if you want to have a slow cooked kind of stew of something, it's easy to do now. We can use this time to actually start and do those things. And to me, that is like super comforting. And then you can use these things, if you haven't got a big family to feed, you can freeze and have these things later on, for another time. But I think it's that relationship with time and food is kind of changed completely. And I kind of am enjoying that right now, quite honestly. If that makes any sense.
Absolutely. There you go. I mean, it's one of those things, we live in such a hustle bustle culture, and food is like sleep, something we do every day and a big part of our lives, but something that we often ignore and don't give it the respect that it really deserves and how much it makes us feel good. So taking a little extra time to be really cognizant of what you're eating and how it nourishes you is extremely important. So that's really great. Thank you so much.
Yeah, well, yeah. I mean, mindfulness when you're eating is a big thing. You know, I mean, it's good to be aware and not just shove everything into a convenient sort of packet, if you like. So.
Indeed. And I may not be British, but I'm a tea drinker as well.
Oh,
So
good
cheers
for
to
you.
you. All right. And now we have talked about, disconnecting from technology, but sometimes that's not always the best option, especially if we need to rely on telehealth in order to get connected to our providers and do the things that we need to do to stay healthy. So starting with Anna from the nursing perspective, how can our community prepare for good telehealth communication with doctors' offices if more shelter in place or safer at home orders happen this winter?
It's a great question because I know that the vast majority of providers are doing mostly telehealth across the country. In my clinic, we're doing a lot of in-person, but that's not the norm. So I think, the most important thing, and hopefully your hospital is having someone call you ahead of time to make sure that you know how to use the technology. But one of the annoying parts about technology is it's technology, right? So it makes mistakes. Our internet goes down, the internet gets slow. There's so many things that can go wrong. So it's really, really important to make sure that if you've never done a video visit beforehand or a televisit beforehand, that you practice, as silly as that sounds. Most of them have sort of, I think, test your sound or test the video system, whether it's, because not all of them are Zoom. Most of them actually aren't, because they want to do they want to make sure that it's HIPAA compliant so that it's private and that, medical information is staying within. So I know, for example, my therapist has one very different than my doctor at one hospital does versus the other. So make sure that you try out the technology and don't just trust, well, I'm, super tech savvy and I know what I'm doing. That's what I've done before. Other things that I sometimes forget is lighting is important, especially if you want the doctor to look at anything. So it's actually better to have the light in front of you versus behind you. So I'm actually not giving a very good example right now. For the longest time, I was sitting by a window because I thought, ooh, then my hair and everything looks better, but it actually is worse for the person viewing you. They also tell you in interviews not to wear complex patterns, and that's actually ideal if you're seeing a doctor as well, just because if there's anything that you want them to look at, it's hard to visualize. And then what I actually would say is the number one that I think us cancer patients are particularly used to doing, but maybe not, is having a checklist of what you want to talk to the doctor about before you go into the visit. So I know some of my patients will have a checklist in a notebook when they come in to see a doctor in person, but it's even more important and honestly kind of a plus of doing televisit in that you can have your notebook right here with all the questions that you want to ask. And if you're like me, you really like putting check marks and being like, I asked that question, great. So that you can stay organized and you don't forget anything, because we all know, oh, there's no way I'm going to forget to ask for a refill on blank. And then you get off the visit and you go, oh my God, how did I forget to ask for my refill? So that way that you have your list of questions, list of anything that you need a refill on, list of any referrals you need. Make sure that you also have access to your medical records in some way. So whether that's a printout, if you're someone who prints it, whether you have something like My Health or My Chart or My Health Connection, one of the various ways. We're fortunate that nowadays there's something called Care Everywhere, where most of us, meaning providers, can access healthcare records across the country, but not always. It depends on the hospital. So don't depend on your doctor necessarily being able to view things as you're having the visit. That's the hope, but they might not be able to. So don't depend on them knowing everything about you. Also keep in mind, as much as I wish that I knew every single personal detail about every patient I have, it's not. Unfortunately, a lot of us are overloaded, and that's just not the case. My oncologist blows me away every time about what she remembers, but that's not everyone. So don't take it personally, but remember to have your medical history with you, especially if you're seeing someone who isn't the normal doctor that you see. And then also, I'll just make a plug that write down when you started feeling symptoms. If it's something new, this is also something I do wrong, where I have a doctor, I'll go in for, and I say, oh, I've been having horrible migraines recently. When did they start? 3 days ago? Maybe it was a week ago. Wait, maybe it was a month ago. I know that's really hard, but that's really important information. So you are going to get asked, when did this start? You're going to get asked, is it getting better? Is it getting worse? Is it staying the same? And you're going to ask what makes it better and what makes it worse. So those are 3 little things there that you can be prepared with, and it's going to really help your doctor or your nurse practitioner or your nurse or anyone that you see, just to make sure that they can get all of the information they can. And the last thing I want to say, if you need to be seen, please don't be scared and don't postpone your care because of COVID and because of the flu. If you have something like a rash that isn't going to show up, I mean, yes, you can send pictures, but if it has a texture that it needs to be felt, you need someone to look inside your throat, like saying you're in chemo and you have mouth sores. Please don't. I know it's scary to go to the doctor right now, but we don't want you to postpone your care and get worse and not be seen. So don't be afraid to say, I can't have a video visit for this. I need you to look at me. Don't be scared to advocate for yourself. If you have something going on that needs to be more than a video visit, don't be afraid to ask for that, because usually there's a way to make that happen, and we recognize that not everything can be seen over video.
That's really helpful to know. I mean, thinking about, what patients can do to really, be able to overcome the fact that even in the doctor's appointment, time is always such an issue, and same thing for telehealth. So what can people do to really start thinking about prioritizing what of those medical conditions or issues they want to bring up during that time? And then maybe some language perhaps for them to help use if they do feel like maybe this wasn't enough and they'd really like to go in and get examined.
Yeah, so for the first question, first part about how to make sure you make the best use of your time, again, I think checklists are really important. And if you can, prioritize your questions. So maybe write down, because it's going to help you brainstorm. First off, start and say every question you wish you could ask. If you had all the time in the world, write down everything. And then, so that might even include, oh, by the way, I'm supposed to have a mammogram in 2 years. Can I, do you think I'm going to need that in 2 years? I don't know. I'm someone who might think that far in advance. So write down all the questions you have and then go back and start to prioritize them. Think about, okay, if I can only have 3 questions answered during this visit, what are those 3 questions that I want answered? What is my priority? And then maybe have it, if you're like, oh no, I really have 6, 7, 8, 9, 10, remember that you can always ask for another visit. There's also a lot of, I'm going to give the example of oncology just because I know that's a lot of our patients. The benefit of a lot of the clinics that we're seen in is they're multidisciplinary clinics with teams that have multiple different providers. So whereas your oncologist, who's an MD, a doctor may not be able to see you for follow-up as soon. They may have a nurse practitioner, what we call advanced practice provider. So that's a physician assistant or a nurse practitioner that may have time to see you. And please don't, think they are any less qualified. Honestly, nurse practitioners are legally allowed more time with patients than doctors are. They're allowed to bill for more time. So reality is you might get more time with a nurse practitioner than you would necessarily with your doctor. So then you can even say, okay, so these are the 3 questions I really want to ask my doctor. And here's some 3 questions that maybe the nurse could answer. Maybe the nurse practitioner can answer, maybe the physical therapist could answer. So there are make use of the other members of your teams. So there are other people that can, and don't be afraid to ask for that. And then with regards to a trick, I would say, and this is not something that I do, but I really should, and this is just out of laziness, everybody has what we call an after visit summary. That is now required, I think, by law now with these televisits, that there has to be a summary of the visit. That's often why you have what's called a scribe in your visit. So there might be someone there who's typing the entire time. It's really awkward, but that's actually because they want to make sure that they really get down all the details. Ask to see your after visit summary. It's not always called that, but they'll know what you're talking about, and then go through it. They can email it to you or put it on one of those My Health Connections sort of situations. It's supposed to be a summary of everything you talked about. And if you see something wrong, bring it up. Be like, hey, I noticed that in here it said that I, asked for blah, blah. I don't remember asking for that. Can you clarify? Or it was super, super important for me to get a referral to nutrition. And I don't see that in here. Just checking to see if, if you got that, or maybe I forgot. And then in terms of tips of language about if you feel like it needs to be, it needs to be escalated. Remember, I'm sure Dr. Lomax would talk about this too, but remember, I statements, just like when we were in kindergarten, elementary school, are helpful. So, when you're writing those messages, don't, being as modest as you can, be like, I'm worried that I forgot to bring up the referral to nutrition. Can you remind me if I brought that up, even if you brought it up? Because it's going to put them less on the offense, or just say, I'm really scared right now. It's okay, versus saying, you didn't answer my question about this. Some of us nurses are really used to the attacking sounding messages, and we don't mind them. Honestly, I know where it comes. I know it's not at me. Some physicians and other members may not be as open to that, but it's okay to say that I'm scared, I'm worried, I don't feel like we had enough time. I know that's not your fault, but can I get another visit?
Great advice, Anna. Definitely. Yeah. Good to be able to take some charge over your own experience in those visits as well. It's a conversation, it's two people, and it's important to remember that as well.
Only you know your body, right? And especially over these video visits, we've all in this community, whether you had cancer or not, gotten really good at masking pain or masking something that's, whether it's emotional or physical. Sure, we have all been on a Zoom call when we didn't sleep because maybe our baby was up all night, or the dog had accident or something. And we've all had to put on that face. Don't expect your doctor to know what's going on based on just looking at you. So like, we all four here look like we're having a fantastic day and we're really happy and we're feeling great. But one of us here may actually be having horrible back pain, or someone died in our families. So don't expect us to, just be able to read body language and be able to, know what's going on without you telling them.
That's a perfect point. Yeah. I mean, nonverbal communications, how we're sitting, how we're approaching, the tone of our voice and everything is the majority of the message we send. And it's very difficult to get a lot of that across over Zoom as we would have regularly been able to in person, which is a really great segue to really saying, we need to make sure that we're encouraging all of you out there to be protecting your mental health and your behavioral health as well as your physical health. So in that same vein of needing to understand that telehealth may be the solution that's right for you, Dr. Lomax, how can our community learn more about telehealth resources that are available for emotional support?
Yep, Anna, that was such a great segue too, to mention that your providers can't read your mind, because I would say that's a first step if you are meeting with a medical doctor, a dietitian, anyone, but you're really struggling emotionally. I think it's really important to mention that. I think people tend to hide those things from a lot of their providers. They want to show they have a brave and stoic face. That's fortunately or unfortunately a real strong value in our country. But to be able to say, I've been really feeling down and I'm wondering what options I have, is a really important start in terms of getting connected with mental health in any format. And I would say if the first response that one gets from a provider is regarding medication, which it can be sometimes because some people think that's what's being asked, I think it's important for people to say, I'm interested in other options in addition to medication, or I'd like to try something else. Because what the research shows us is that talk therapy can be equally as beneficial, if not more beneficial, than pharmacotherapy for a lot of emotional disorders, for long-term remission of those disorders. So that I think, important not to feel dissuaded from talk therapy if the first response is a medication, because I've heard that from a lot of my patients, that they told their oncologist or they told a nurse that they were feeling depressed and they say, oh, we can write you a script, when they really wanted a recommendation of someone that would be a trusted provider, a mental health provider to talk to. Fortunately, I think given the stress that our country's been under over the last 8 months, there is greater acknowledgement of the need for mental health care for ourselves. I'm seeing this in the New York Times. I'm seeing this all over the place. I think the stigma around mental health care is decreasing and hopefully increasing access. The question around telehealth is a good one because, you know, I was an early adopter in some ways because of my specialty. I had patients all over the state, but I often felt that it was, as a provider, not quite the same as being in the room with someone. And I will say that's still the case, but 8 months into this, I have established relationships with patients I've never met in person, and they feel equally as powerful as the ones that I have with patients that I've met in person. So for folks that are wishing that they could meet with a provider in person, there are some circumstances where a lot of us are allowing that or creating safety measures around that because, for example, I have couples that are working from home together. There's a lot of tension at home and they're talking about, you know, one another, and they really would like to be out of the house for their therapy. Or if there are other circumstances, domestic violence, for example, where it's not safe to do the therapy in the home, there are providers who are willing to see people in person. So I know I'm kind of going off your question, but I think some people think I'd actually like to see someone in person. And there are ways of doing that. If the circumstances require or put somebody, you know, if the risk benefit bears out that way. With regard to telehealth and accessing teletherapy, most providers across the country have pivoted and are offering teletherapy. Just as Anna said, you know, most providers are meeting in person. I think the big piece is finding a provider that works for you and has specialty to meet your needs. And so I would say some of the important things to look for are someone who, if you're dealing with coping with your cancer related condition or as a caregiver, looking for a health psychologist or a medical social worker, someone who's worked in a medical setting and has awareness of the typical stressors around coping with a chronic illness. Because if you were to go to someone that didn't have that, they may over pathologize things that are related to your cancer condition or your treatment and think that you have depression, when in fact the fatigue and the low energy are completely related to your treatment and you're actually adapting quite well. So I would recommend people look for folks who have medical background if you're dealing with coping with illness. And I would say be skeptical of things such as Talkspace or text related therapy. There are these options right now. Apparently they have licensed providers doing the responsiveness, but I don't think we can actually call that therapy. It may be some sort of crisis intervention or some sort of counseling, but I don't think you can get long-term care that way. So I encourage people, they can certainly try those kind of things, but if you're really looking for some in-depth increasing self-awareness, increasing effectiveness in life, it's not going to be done via text. It's not, I mean, often therapy really is about the relationship between the client and the therapist. Check with one's insurance. Most insurances are still covering teletherapy. That was true initially, and I think they've expanded it. I don't believe, if you have mental health as part of your insurance, typically they're going to pay the provider who's under their panel no matter what, if they're providing it via teletherapy or in person. But it is a question to ask because some insurances may be shifting away from that. And then there are ways of accessing, there's kind of a search engine through Psychology Today. I would say look for licensed providers. They don't require someone to be licensed, so they could be a life coach, which there are certainly areas for life coaching, but there's not licensure requirements around that. So I would just look for a licensed provider who has experience in medical settings or working with medical patients versus just a general mental health provider.
Great. And certainly, when you talk about licensure, it's not just relevant to a level of experience and understanding, but also, the ability to protect you. That's a big
100%.
thing about what licensure is about and why that's so important. So that's really great for you to share. And I really do appreciate you expanding upon really not just telehealth, but still looking at options for people to still be face-to-face, albeit in safe measures and everything like that, because this is
Right.
complicated, and looking at really the interconnectedness between physical health and mental health. We do see stigma on the decrease, but we have a long way to go. But certainly we all encourage you to do what you need to do to be healthy and stay healthy on both sides of that coin. So thank you so much for that. And finally, I know Amazon Prime Day is coming up in a couple weeks. I'm going to want to get a couple new kitchen gadgets for this season for sure. And what are your top kitchen gadgets for this year to have some fun making these meals with you and your family?
So my favorite kitchen gadget is a pressure cooker. I don't like some of the more complicated ones because it means that you can cook things that take a long time to cook, like stocks, like bone broths and things like that. You can make in an hour, so you can just have that going on the back of the stove. And that's an expensive item. Cheap item, which everyone should have to make their life easier, is a microplane grater for zesting lemons. Be able to get all the best out of your citrus and out of things like fresh nutmeg, these kinds of things. Because when I was going through chemo, I couldn't tolerate lemon, but I could tolerate lemon zest. So my zester was great because I could just pile it on into whatever I was making. And I think a good safe non-stick pan, if such a thing really exists. I have cast iron pans at home, and that's not for everybody because they can be heavy. That's my workout. But the thing is that they can make certain things which are kind of fun to cook, especially breakfasty things, so much easier. From eggs to pancakes to omelets to anything. So a good pan like that. And now you can get ceramic ones, which are not so bad. But that's what I think would be good. That's what makes me smile at any rate. So simple things.
Excellent. Yes, simple things. So thank you all so much. I feel pretty ready for this flu season myself. This is really great answers to all these questions, and certainly have some things on my list to buy coming up here. So yeah, once again, thank you all for being here, and thank everyone out there for watching or listening. This has been Wellness Wednesday, and we will see you in a couple weeks for more wellness tips. Bye.